Hello student, today I will be taking one of the gynecological disorder, that is cervical cancer. Obstetric and gynecological nursing is one of the major subject for nursing student. So cervical cancer is a gynecological disorder. So what is cervical cancer? So abnormal cell growth found in the cervix. So you can see here, if you know the normal anatomy, then you can, like a mental image, you can get which part is a cervix. So this is a normal uterus. This is a fundus of the uterus. This is a body of the uterus. This is fallopian tube. This is ovary. And here the lower part, this is a vagina. Above the vagina, the cervix is there. So this cervix will connect the lower part of the uterus and upper part of the vagina. See, here you can see in this picture, this is a normal cervix. See, the normal cervix, it will be like this. When the cancer cell begins, means how it should be. See in the picture, you will get the idea. Even you can see it here also. When one or a two means it is a cell, cancer cells. So many cancer cells together will form a tumor, like a stone like that, hard. Abnormal cell growth in a lower part of the uterus that contact upper vagina. So that is a cervix, or you can tell abnormal cell growth in the cervix. So what may be the incident? Cervix and breast cancers are the leading sites of malignancies in females. So the females are either they will get a cervix cancer, majority of the females, where even I too have seen in a hospital setting, either cervix cancer or a breast cancer. Cervical cancer is the fourth most common cancer in women globally, means entire worldwide it is in a fourth place. So you can imagine then. Types, there are major two types are there. The first one is a squamous cell carcinoma and the second one is a adenocarcinoma. Squamous cell means you know that the squamous cell covers all the organs, skin, respiratory system and all the system, uterus, everywhere squamous cell is there. It is a covering membrane, right, covering this. So squamous cell carcinoma, 90% of the cervical cancer is a squamous only, means outer part of the cervix the cancer will begin. Adenocarcinoma, it is one of the worst type. The cancer cell will begin from inner part of the cervix. So these are the two major types of cervical cancers. Okay, what may be the causes and a risk factor for cervical cancer? Human papilloma virus infection, continuously the infection will be there. How come human papilloma? Having many sexual partner. Bad habit like tobacco, smoking, engaging in early sexual contact in a very small age only without using any contraceptive or a protective device, going on having with a multiple partner. Recurrent genital infection, when recurrent genital infection, having having multiple sexual partner or not maintaining good personal hygiene, like suffering with the sexual diseases, HIV, chlamydia infections, syphilis and gonorrhea, and there are many other. Immune system suppression, especially in case of HIV and some other disease. Overweight. Long-term use of oral contraceptive also not good. Having a first full-term pregnancy before age of 17. So early pregnancy and having child is not at all good. So the preferable age is the body should be preferred to ready to be ready to have to conceive and to capable to bear that pregnancy. That is usually after the age of 20 or 22 only. Poverty, undereducation, poor hygiene. So how come this poverty will lead to cervical cancer? Poverty, due to poverty, the person will not be educated. So since the client doesn't have a education regarding how this cancer will occur, how to maintain the personal hygiene, available of protective devices, all that things. So if the person is educated only, he or she could capable to read, through reading, get the knowledge. Family history of cervical cancer. So all these are the major causes for the cervical cancer. So let me see what are the signs and symptoms. So you can see there will be a plenty of signs and symptoms will be there. Backache, bleeding after intercourse, abdominal, vaginal discharge, either it is a foul smell or without smell, white in color or a bloody color, like a red mixed color. Bleeding after menopause also. Menstrual irregularities will be there. Abdominal pain, pelvic pain, weight loss, like a heavy menstrual bleeding, dizziness, fatigue, blood in the stool, leg swelling. So all these symptoms will be there. So what are the common symptoms? The common signs and symptoms are abnormal vaginal bleeding, increased vaginal discharge, either white or a red in color, smelly or not smelly. Bleeding after menopause. Menopause means a stoppage of a period. So after stoppage of period also, after the age of 50, 55 also, getting heavy bleeding. Pain during sex as well as after sex. Severe pelvic pain. So these are the common symptoms will be there. See, you can see in the picture. See, this is a normal cervix. This is a carcinoma. Cervix means cancer cell is found. See, beginning stage, how it will be. So the cancer cell, many cancer cell will together form the tumor. So then later how it will become, it will going on spread one organ to another organ, entire body it will spread. Okay, how to diagnosis? One is when the client comes, the history collection with the thorough physical examination the doctor will do. And like signs and symptoms, when client say itself, the doctor will get the idea. And the vaginal examination, especially the gynecologist will be, the lady doctor will with the glove finger insert inside the vagina and rotate and see, and she could feel if any hard or the surface area, if it is become some kind of a roughness means, okay, she will get the doubt, and along with that she will take a cervical pap smear and send it for the histopathology or cytological in order to know whether cancer cells are present or not. Colposcopy means a visualization of the vagina as well as the cervix in order to see any superficially cancer cells are found. Chest x-ray in case of it is a spread in order to know how much and which all the parts are involved. CT scan, MRI, PET scan. PET scan is same like a CT scan, okay. Cystoscopy, visualization of the bladder to know bladder involvement. Proctoscopy, visualization of the anus, bladder and colon as well as a rectum. In case of to know the extent of cervical cancer. Okay, colposcopy means just go through if they ask for 1 or 2 marks, it is a visualization of the vagina plus cervix, okay. Through visualization and the biopsy is collected, that is only pap smear. Stages of cervical cancer, it is very important, okay. The stages means when client approach the doctor, when doctor do the means like a thorough physical examination during the investigation, at what stage means till how much it is a spread. So according to that it is a staged, okay. Stage 0, the abnormal cells are only on the surface of the cervix. It is not spread anywhere, okay, only surface of the cervix here and there. So it is called as a carcinoma in situ. Only in particular area the cancer cells are found. Stage 1 means there is a small amount of tumor, means many cancer cells together form a tumor present, and that has not spread to any lymph nodes or any outside part, okay. It is inside the cervix only, and it become like a small tumor is found. Stage 2, the cancer has spread beyond the cervix and uterus and a lymph node, but does not invade the pelvic wall or a lower part of the vagina, okay, where it is a cervix and there only surrounding, not lower part of the vagina. Stage 3 is that the cancer has grown into the lower part of the vagina and pelvis. The tumor may be blocking the ureters. What ureter does? It convey urine from kidney to bladder. So that cannot use, since the ureter is compressed, so urine will remain in a kidney itself, so it leads to abdominal pain, like various other health issues. Stage 4, this is the advanced stage, and here in this stage 3 and 4 difficult to treat, okay. They will treat but some extent to increase the lifespan and to quality of life to make it a better, okay. Most advanced stage, because already through the blood circulation and the lymph circulation it is spread to various vital organs. So you can see in the picture, first picture, cancer is small and has no spread to other parts. Here you can see. In the second picture, cancer has grown. This is stage 2, okay. Cancer has grown and may have spread to lymph nodes. See, here you can see. lymph node, it is already spread. Stage 3, cancer has spread to lower part of the vagina or a pelvis. See, this is the cervix, this is the vagina, okay, lower part. So this cervix, where it joins means upper part of the vagina and lower part of the uterus. At the center it will be there, okay. So stage 4, cancer may have spread beyond the pelvic and other organs, means outside in terms like a vital organs like a liver, kidney, bladder, and lungs, everywhere. So you can see in the picture normal cervix, how it is. See few cancer cells, tumor. See the above pictures, how it is. Management. So as usual, you know, if it is a cancer means the cancer will be either treated with a surgery, along with the surgery, radiation therapy, chemotherapy will be there, and other depends upon which kind of a cancer. Okay, here since it is cervical cancer, it is treated with the targeted therapy, or it is called as a immunotherapy. So surgery, ablation therapy, it is done in case of early stage of cancer. Okay, uses cold or a heat to destroy cervical cancer tissue. Especially kind of a probe is used. It is inserted through the vagina and directly place it over the tumor, and tumor is destroyed. It is done in an early stage of cancer. Second one is a loop electrosurgical excision procedure. Here uses a wire loop heated by electrical current to remove cancer cell from the cervix, done under local anesthesia. It's only take 20 to half an hour. Okay, this procedure also done in an early stage of cancer. The third one is a salpingo-oophorohysterectomy. It's a major surgery only. Removal of this fallopian tube, ovary, uterus, cervix, everything. Okay, all the parts are removed. Means wherever the cancer cells are there, almost everything is removed. Hysterectomy, removal of the uterus as well as the cervix. It depends upon how much it is spread. Okay. Radical trachelectomy. If the couple, if the lady is desiring to have child and she has got cervical cancer in very early age, then the doctor will just remove the cervix and the upper part of the vagina. Pelvic exenteration means in case this will done in case of advanced cancer, based upon how much the cancer is spread. According to that, not completely all the organs are removing. Where the cancer cells are more, that part is removing. Okay, removing the cervix, uterus, surrounding organ tissue near lymph nodes, depending on cancer spread, bladder, vagina, rectum, and part of the colon, not entire organ. Okay, if entire organ is removed, means the client cannot be survive. Okay, where the cancer cells are located, accumulated more, so that part will be superficially is removed. Okay, radiation therapy means, you know, here teletherapy as well as brachytherapy will be delivered. Teletherapy means the radiation therapy is kept away from the client. Brachytherapy means the radiation therapy placed inside the body itself, or in the form of injection it has to be given. Okay. So you know the major side effect of radiation therapy is fatigue, diarrhea, skin changes, nausea, vomiting, irritation of the bladder, vaginal irritation, vaginal discharge will be there. So all these things before the client receiving has to explain, and the doctor will be doing that. Okay. Chemotherapy is a chemical substance used to destroy the cancer cells, especially here cisplatin and 5-fluorouracil, along with other cancer like chemo drugs are used. Okay, the major side effect is alopecia, means hair loss, nausea, vomiting, fatigue, mouth sore, and a tiredness, weakness, and many other side effect will be there. So this has to be explained to the client, and it has to be done by the doctor. A nurse, as a nurse should also aware of this. Targeted therapy means it's a kind of a specially prepared drugs. It is used to interrupt cellular process. Cellular process means in the initial stage itself, when the cancer cell is growing, they destroying the cancer cell. So already which cancer cells are there, that will be there. The new growing cancer cells are destroyed. There are several like antibody content drugs are there. Okay, so in that one is Avastin. So you can read that. Okay, as well as this vaccine also. HPV vaccine also comes in that only. Prognosis. Prognosis depends upon at what stage it is identified. If it is a stage 0, 1 and 2, at least can survive, because immediately after the chemo, radiation therapy, surgical therapy means at least 0, 1, 2. Third and a fourth, it is quite difficult, okay, because already the organs are involved, it is a spread, so it cannot be removed all the organs. The treatment will be given in order to increase the lifespan as well as to improve the quality and to reduce the symptoms. Nurse's responsibility assessment, since the client is undergoing for the surgery, pre as well as the post-operative assessment will be there, include history collection and physical examination. Based upon that, nursing diagnosis will be there, and like counseling, explanation, patient teaching, follow up, and whatever therapy, radiation therapy, that's a side effect, everything has to explain in a very rational way, okay. And there are preventive measures are also there that has to give an entire family as a health education. Prevention measures are HPV vaccine for young girls, that is a papilloma virus vaccine. Good personal hygiene to maintain, to take a daily bath, after the bath to change the dress, if any white discharge or any kind of, immediately to approach the doctor and to take a proper medication, all that. Developing good habit like lifestyle changes, all that things are very important. And giving educating to avoid multiple sexual partners, and giving them the idea or education about the protective devices. Many they doesn't know about the availability of the protective devices. After age 35 years, screening test, especially for the ladies, pap smear. After the age of 35, cannot predict only, can prone for all kind of a disease and a disorder. So it is a better at least once in a year having a medical checkup. Avoid early marriage and having kids. That has to be delivered while giving a health education in a mass health education group or an individual health education. So this to give the importance of cervical cancer, how to prevent it. So the WHO has declared November 17 mark the cervical cancer elimination day. So every November 17th, cervical Cancer Day is celebrated, and that day everywhere the mass health education is given to the couples, every single individual. So through this they will get the idea as well as a knowledge. So this is a responsibility of the every health professionals. As a nurses, it is our major responsibility. So thank you, hope students you are understood about this. So go through. If you are not understanding, you can comment in a comment box where you need a more explanation. Thank you so much.